Hello, my name is Tatag I'm from D3 Pharmacy, Polteka, Mangunwijaya. My student number is 222025. Now, I will tell about cancer and lung cancer. Cancer is a disease caused by uncontrolled growth of abnormal cells in the body. This abnormal cell growth can damage normal cells around it and in other parts of the body. Cancer is the second most common cause of death worldwide. Cancer often causes death because this disease generally does not cause symptoms at the beginning of its development. As a result, this condition is only detected and treated after it reaches an advanced stage. The main cause of cancer is genetic changes, mutation, in cells so that the cells grow abnormally. Actually, the body has its own mechanism to destroy these abnormal cells. However, if this mechanism fails, abnormal cells will grow uncontrollably. Factors that can trigger the growth of cancer cells vary, depending on the type of cancer. However, there is no specific type of cancer that is only triggered by one factor. Factors, though thought to be at risk of causing genetic mutations in normal cells and the body's failure to repair them include family history of cancer, age over 65 years, although some types of cancer are more common in children, smoking habits, exposure to radiation, chemicals such as asbestos or benzene, or sunlight, viral infections such as hepatitis B, hepatitis C, and HPV, exposure to high levels or long-term hormones. Obesity, not moving, not exercising regularly, diseases that cause long-term inflammation such as ulcerative colitis, decreased immune system, for example, due to suffering from HIV or AIDS. Symptoms that arise due to cancer also vary depending on the type of cancer and the body organs affected. Some complaints that cancer sufferers often experience are lumps appearing, pain in one part on the body, pale, weak, and tired quickly, drastic weight loss, disorders of defecation or urinations, chronic cough, bruising, and spontaneous bleeding, recurring fever. To diagnose cancer, the doctor will ask about the patient's symptoms and conduct a physical examination. After that, there are several additional tests that the doctor will do to confirm the diagnosis of cancer. That is, laboratory examinations such as an urine test, blood test may be done to check for marks in the body. Doctors can also do tumor marker examination to detect cancer. Scanning. This test may be any X-ray, ultrasound, CT scan, MRI, or PET scan to view the condition of the problem organ. Biopsy. In this procedure, the doctor will take a sample of the patient tissue who is suspected to have biopsy, which is the most accurate examination to determine whether the patient has cancer or not. Based on the results of the examination above, the doctor will then determine the severity stage of the cancer. In general, cancer levels are divided into stage 1, 2, 3, and 4. The higher the cancer stage, the more severe the symptoms of the disease, and the smaller the chance of recovery. The stage of cancer will be determined based on the size of the cancer, whether the cancer has spread to nearby lymph nodes, and how far the cancer has spread to other organs. The type of treatment the doctor will choose depends on several things, starting from the type of cancer, location on the cancer, stage of the cancer, the patient's general health condition, and the patient wishes. Commonly used cancer treatment methods are as follows. Chemotherapy. Chemotherapy is done by giving drugs to kill cancer cells. Operation. Cancer surgery is performed by cutting and removing cancer tissue. Radiotherapy. Radiotherapy is carried out by exposing radiation rays to kill cancer cells. There are two types of radiotherapy, namely radiation from a machine outside the body, external radiotherapy, or radiation from an implant placed inside the body. Next, bone marrow transplant. Through this procedure, the patient's bone marrow will be replaced with new bone marrow from a donor so that it can produce new cells that are normal and free of cancer. Immunotherapy. Immunotherapy or biological therapy aims to activate the patient's immune system to fight cancer. Hormone therapy. Some types of cancer, such as breast cancer and prostate cancer, are triggered by hormones, therefore inhibiting these hormones can stop the growth of cancer cells. Next, targeted drug therapy. Targeted therapy is carried out by administering drugs that can inhibit genetic mutation in cells. The above cancer treatments can cause various side effects, one of which is a reduction in the number of white blood cells so that the patient body is susceptible to infection. The Ministry of Health of the Republic of Indonesia is promoting the Cerdik behavior program to prevent the cancer. The following is what Cerdik stands for. C. Check your health regularly. Consult your doctor about the need for a cancer screening test based on the risk factors you have. G. Get rid of cigarette smoke. Smoking can increase the risk of various types of cancer, especially lung cancer. Have regular physical activity. Exercise regularly for at least 30 minutes every day. Next, healthy diet with balanced calories. Eat more fruits, vegetables, whole grains, for example wheat, and foods rich in protein. Enough rest, lack of sleep can increase the risk of developing cancer. Next, manage stress. Excessive and prolonged stress can cause cancer. Apart from SMART, there are several other things you also need to do to prevent cancer, namely, avoid excessive sun exposure. Exposure to ultraviolet rays from the sun can increase the risk of skin cancer, therefore wear close clothing when do outdoor activities. Use a mask in place full of air pollution, motor vehicle fumes, factory fumes, wasp, burning foam, cigarette smoke, and asbestos. This can cause cancer. Stop consuming alcoholic beverages. If you like drinking alcoholic drinks, start to stop this habit because alcohol can trigger cancer. Get vaccinated. There are two types of cancer that can be prevented by vaccination, namely liver cancer through the hepatitis B vaccine and cervical cancer with the HPV vaccine. One of type of cancer is lung cancer. Now we will talking about lung cancer. Lung cancer is cancer that forms in the lungs. This cancer is one of the most common cancer in Indonesia. Globally, lung cancer is the first cause of cancer death in men and the second cause of cancer death in women. Although it often occurs in smokers, lung cancer can also occur in people who are not smokers. In non-smokers, lung cancer occurs due to frequent exposure to cigarette smoke from other people, or namely passive smoking, or exposure to chemicals in the work environment. Based on its development, lung cancer can be divided into two types, namely non-small cell lung cancer. This type lung cancer is the most common. namely around 87% of all lung cancer cases. This type has three main types, namely adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. And then small cell lung cancer. This type of lung cancer is rare. In contrast to non-small cell lung cancer, small cell lung cancer can spread very quickly. Most cases of this type of lung cancer are caused by smoking habits. As for the cases and symptoms of lung cancer most often occurs due to smoking habits. However, people who do not smoke can also suffer from lung cancer, especially they are frequently exposed to air pollution, live in an environment contaminated with dangerous substances, or have a family member who suffers from lung cancer. Lung cancer often causes no symptoms in its early stages. New symptoms appear when the cancer large enough or has spread to surrounding tissues and organs. Some of the symptoms that lung cancer sufferers can experience are chronic cough, shortness of breath, coughing up blood, and chest pain. As for treatment and prevention of lung cancer can be treated in various ways depending on the patient condition and the severity of the cancer. The main treatment for early stage lung cancer is surgery. If the cancer has reached at advanced stage, treatment can be done with radiotherapy and chemotherapy. Lung cancer can be prevented by stopping smoking or avoiding cigarette smoke. For someone who is at risk of developing lung cancer, regular examination should be carried out. Apart from that, it is recommended to exercise regularly and eat healthy and nutritionally balanced foods. That's all from me about cancer and lung cancer. Thank you!